So we're talking about Forma. This is the easiest entry point for a lot of our patients. This is the Forma and Forma Plus. And this one's designed for larger body areas. This one's designed for areas like smaller areas or around the face. And what we're doing is we're delivering the bipolar radio frequency to transdermal fashion to elicit the change in the tissues that we want, either tightening, wrinkle reduction. And I told you how it works. We put it on the skin, ultrasound gel. Radio frequency goes from positive to negative pole, back and forth, creates all that jostling in the molecules, which creates heat. Heat ultimately creates the fibroblasts to do what they do best, and that's lay down new collagen, repair old collagen. We get the response that we want in the tissues. That's what we're doing through all of this. Here's my fear with Forma, friends, is that it's perceived as being a dinosaur. Where is the Forma? It's perceived as being a dinosaur. And here's what I mean by that. It was one of the first hand pieces that InMode got famous with. Do you guys remember, what's her name? It starts with a K. It's Kardashian? Just kidding, of course. You guys know who Kim Kardashian is? Yes. 2016, she's in Dr. Jason Diamond's office, unsolicited by InMode. We didn't ask for it. She's on her giant, mega, behemoth media platform, all of her followers, and she's just selfie mode doing a Forma on herself, on her jawline, and everyone's like, what is that secret to beauty? It was the Forma. That was in 2016. So it exploded. And it is since, because of all the new drops and all the new things that InMode's done, I think it's gotten kicked to the back corner. If you're not using your Forma, if you have one, or if you don't have one, well, I'm going to show you where we use it and how to position the practice, because we love our Forma. I mean, I love my Forma. Okay, so this is where we utilize, and just this is Maningas. This is not standard of care, so you could take it, leave it, fight with me about it. It won't hurt my feelings. But this is how I use it. Maybe it'll be helpful. I do love it for the hands-on approach. So this requires a technician. Varies from state to state to state. But in the state of Missouri, estheticians can do this, nurses, nurse practitioners, pretty much anyone in the practice with basic medical training could provide the Forma in the state of Missouri. And so it requires a technician to apply the treatment. I think there's a lot of value in that. Remember, everything's moving towards AI, hands-free, all that. So my patients actually love the opportunity to have one of their caregivers give them care. Now, there is another way to position the hands-free stuff. There's value in that, too, to not require a technician to do these treatments. But we actually promote this for its hands-on approach. Like, that is the beauty of it. Your most favorite nurse injector that has injected you for the last 6 years is the one that's doing this treatment. So the hands-on approach, it is a positive, not a negative, but it does require a technician. The other way we use this is precise, small areas. This is in contrast to some of the hands-free devices. So when we get to that this afternoon, you'll see we've got devices that do essentially the same thing as Forma, but it doesn't require a technician. You just strap it on and you go. The beauty of that is you can do multiple things at the same time because your hands are free, right? That's the beauty of that. But with this one, what this does is hit the areas that the hands-free devices can't hit. So for example, the Evoke, which is the hands-free submental and jawline unit. It just gets put on your head. It only treats the jawline and the submentum. What if I don't like the skin on my anterior lateral neck?